New Hope Community Development Group, which is a nonprofit that I am the president of and co-founder. We were already concerned and trying to work up a program where we could get a physician in this community. The last time a doctor's office was in this community was around 45 years ago. These folks would have been really in dire straits because they would have had to ride from here to Moses Cone and sit in that emergency room for how long. And people are not patient. You know, when they're hurting, they want to be seen. If they can't be seen, then they want to go home. If I'm gonna be miserable, let me go home. But mustard seed is here. So now they got a place where they can go come to as right in the community. So if they on crutches or have a wheelchair or just got a relative that just can come and pick them up and drop them off, they have to drive less than 3/4 of a mile to get to see the doctor. Beth Mulberry was God sent. And then the healthcare outreach programs that Mustard Seed implemented on their own since they've been here, using community members and church members, New Hope church members to go out in the community and access the needs of the families that's in this community. And then they bring that data in and do their analysis and find out what they may need as a health outreach person to go by there and visit their family. So the community really did not do a lot of communicating with one another because of the different language barriers. But now we're seeing more of the community members talking to each other.
What I'd like people to know about Mustard Seed is that this is more than a clinic. This is a community health home where people can come and get medical care, they can get other services, they can get referrals for other services. This is a place where we like to think of people can come and sit down and talk to the staff. And I think that brings on the aspect of getting to know the community. And that way people can get other services that they may need. They can just ask general questions. We've had people who maybe don't have a clear understanding of how to take their medicines, how to actually give a shot with a needle, those types of questions. And so we have a nurse on staff that's available and willing to work with people to do that. That might not be something that you would get in a larger medical office. We like to think that we put that down home, that personal touch in the services that we provide. And that is one of the reasons why I'm involved and excited about being involved with Mustard Seed, because we do more than just a health clinic. We are your community health home. Mustard Seed has changed a family's life or an individual's life because of the wraparound services that we provide. Again, as I said, if a patient comes in and they get the medical care from Dr. Mulberry, they also, maybe they need furniture, maybe they're sleeping on the floor. And so we partner with our collaborative partners and we have provided people avenues to get furniture. We have the community gardens out back that are managed by New Hope Community Development Group. And if the doctor says people need to eat more vegetables, then we grow them and people can come out and get some vitamin D from the sun and get their vegetables. And so it's just a win-win situation. I think too, because Dr. Mulberry has the ability to even do a home visit. I think that's very important. We have quite a few seniors in this community who may not be able to come out and see the doctor. So she's willing to go to the home and see those patients as well, because we're truly a community setup.
And it really is for the betterment of our community. It's right here in the community, which it's so accessible. Most people here in the community might not have transportation. You don't have to try to get a ride or get on the bus line or anything like that. It's right here in the community which is a very important factor in the Cottage Grove area. And she spends quality time with her patients, which is not what you're gonna get in an emergency room setting. You're not gonna get, and she talks to you not like a medical professional, but she talks to you like a human being. And that is so important to us, it really is. You know, because that's the way the doctors were, and they knew the whole family. I love Mustard Seed and Dr. Mulberry.
What attracted me to Mustard Seed was a lot of the way that it's integrated into the community. So not only the ways that we treat patients that come to the clinic, but some of the ways that we're involved with the surrounding community. So one of the ways that I see Mustard Seed having a big impact is that we look at a lot of the things that are challenges or barriers for people and are able to recognize those and understand those and how they impact people's health. So an example is somebody that has had trauma in their past. Their health outcomes are going to be worse, partly because of stress hormones that have been increased over time in them, but then also because of some of those kind of psychological barriers to being able to do things like stay on their medications or get to all their appointments. All of those things are impacted. And so we look at not just, you know, this person needs to come to their appointment, but what are we doing to support them through all those barriers? I feel really proud about how much we do with so little. You know, we have really limited resources, but I feel like we're able to do a lot with that. Whether that is the medical part, the mental health part, whether that is supporting the tutoring program at the resource center in the community. So I think that we're able to do a lot and to think about things in a way that a lot of clinics wouldn't. I think what we do at Mustard Seed is how all healthcare should be done. I think that, you know, we live in a world where medical care is really siloed off from all other types of care, and they really shouldn't be. Because if you are treating the whole person, you have to look at everything that's happening in their life and the things that are happening in their community, and you really can't look at those separately.
The people makes me proud to be associated with the Mustard Seed when I walk down the street and I see someone that we have helped or somebody that have benefited from the service that we offer, and they come up and give you a hug and they thank you for what you have did for them. So those are the things that make me proud to be associated with the Mustard Seed.